Zach from the Try Guys tries to get his hair back. That was horrible. Right, so you may have heard of the Try Guys on YouTube. They have a massive subscriber base. I think it's 6 million or maybe even more than that at this point, subscribers on YouTube, and they've been around for a few years and they've got a pretty good channel. But they caught my attention recently where a couple of weeks ago, one of the members of the Try Guys, his name is Zach, he's talked about his hair loss in the past, but in the episode or episodes that came out a couple weeks ago, he actually went through a hair transplant surgery, and we're going to discuss what happened and critique what may or may not could have gone better. Okay, let's get started.
I'm getting hair restoration surgery. This is the first thing that really bothers me, is that it's just going back. I really debated a lot about whether to make these.
Okay, I want to stop right here. So what I'm noticing with just this bit of exposure for Zach's scalp is that he seems to be only really be concerned about the frontal third, his hairline receding and the frontal third becoming very miniaturized. But what I'm seeing here is that he has extensive hair loss in his future if he's not on medication. Let's continue.
At Barber Surgeons Guild, because of the robotic technology that they had, that's when I knew that that would put his hair concerns at rest, because your concern was surgery and your other concern was scarring.
I'm hoping that...
Okay, first off, one of the first rules about doing your research for surgical hair restoration is don't listen to your hairdresser. You can listen to your hairdresser if they say that they've seen some great work, but don't listen to your hairdresser if they're trying to advise you on details that you're concerned about aside from the work looking natural. That's just, no. And this guy is a classic example of why you don't listen to your hairdresser.
We sort of break things here into two different categories. Like, what can we do to stop hair loss? And then what can we do to bring hair back that's already lost? To bring hair back that's already lost, that's restoration. So as a rule of thumb for guys, what we want to do is kind of average the distance between chin and nose, nose and brows, brows to hairlines. Also raise your eyebrows all the way up. I never want to get really about a centimeter too close to that future.
Stop right here. This is not a rule of thumb across the industry. It might be a rule of thumb in his clinic, but the rule of thirds doesn't work for every patient because it's not taking into account the issue of supply and demand. Most patients, when they have aggressive hair loss in their future, like Zach does, they don't have enough donor hair to sufficiently restore the hairline, assuming it's placed along the approach of the rule of thirds, and give enough restoration for the top and the crown, should that ever be a need. And most physicians will believe, or do believe, that if you use a rule of thirds and place a hairline as low as this, that in the future, if and when more loss occurs, that there simply won't be enough hair, and the appearance can look somewhat lopsided, favoring the front too much as opposed to the back. It's not as balanced as it could be, but that's just a general observation. Let's continue.
The thing that drives me crazy is I put my hair here, but then sometimes there's like a line, there's like a little triangle between the bottom of my hair.
I think the best thing to do for you is we kind of take this central line and we just kind of bring this down a little bit over to here, and we reestablish these angles. The most important thing to keep in mind is this is a hairline that we're committing to not just for now, but for when you're older, because these are permanent hairs that we're moving. So we don't want to make it inappropriate.
That's true. I mean, generally it's generally expected that the hairs will last a lifetime. Regarding this hairline design that he's put on here, it's a pretty good design. I think it's a little too low, but my concern is that he's bringing forward not the temple points, but the area between the temple point and the temple juncture, or he's bringing forward the temples itself. And I don't see here where he's talking about thickening the existing temple point. And yeah, we'll move forward on this.
appropriate looking as you age. We want to keep it.
What would inappropriate be?
Well, I mean, like, you don't want to go and make a 16-year-old hairline and be an 85-year-old guy.
I don't want to look the way I looked when I was a kid, because I was not, I was an awkward-looking kid.
I'm nervous for tomorrow. I don't know, it's all so much more real now that I have this haircut. It is crazy, like, this is by far the boldest thing I've ever done with my hair. I'm just gonna go forward confidently and yeah, I don't know what else to say.
That's a very common position that patients find themselves in the night before surgery. It kind of hits them, regardless of the haircut. That has nothing to do with it. That's the trigger point for him. But most patients do go through this kind of, oh shit, what am I doing moment. And so I like that they're showing this. This is pretty cool.
I'll see you tomorrow.
Procedure starts pretty early in the morning. You arrive between 7 and 7:30 in the morning. We start the planning. That takes us about a half an hour. We're going to draw things out together, take a bunch of measurements, take into consideration if you talk to the stylist the day before, and we're going to make a plan.
I don't want to change your look too much. I just want to give you a lot of density. Change this roundedness and give it a little bit more of an angular sort of look. Could always go lower later. You can't go higher. Let's try.
That is a very important point, and by looking at this, it's obvious to me that his hairline is higher on the morning of surgery, or the markings, than it was during the pre-op the previous day when they're talking about the rule of thirds. This is significantly higher, and what he said is, it's actually one of the things that I say, is you can always bring a hairline down later if you want to and there's enough donor hair, but you can never legitimately raise it back up if you find out that it is too low the first time around. So that's a very important point, and I agree 100%.
Draw it out, splitting the difference, and see how it looks.
Yeah, we're gonna go a little more conservative because I still want to be me.
This is what we propose.
Oh, wow. Yeah, I mean, it looks good to me.
All right, we have a plan.
We got a plan.
So I'm just drawing a box back here that the doctor's gonna numb where we're gonna get the hair from.
Why do you need it short?
For the robot to recognize it. The robot needs it between 1 millimeter and 1.3 millimeter.
As I'm looking at the profile here, I'm seeing two things that concern me. I see that the box where the target donor area has been established. I see two shortcomings here, in my opinion. I see that it is not far enough forward on the sides. In other words, they're not utilizing the bilateral donor zone. They're keeping it to the occipital area, but also the template or the frame of the extraction area is a little too high, as it looks to be venturing into the lower crown area. And if you remember before, I was saying that this kid, he's 28 years old, he is destined for aggressive hair loss. In my view, I think that a Norwood 6 is in his future if he's not receiving positive experience from the use of finasteride. So this is something that's a little bit concerning for me.
But just focus on this vibration here. It's going to help distract the nerves. The same nerves that respond to pain respond to vibration. There's a little bit of adrenaline mixed in with this numbing fluid.
That's why I'm feeling hyped up right now.
If you're feeling a little bit, yeah, exactly.
Okay, because I didn't have any caffeine today, and I feel hyped the fuck up.
If you feel anything sharp throughout this process, you have to let me know, okay?
Okay.
Otherwise, I won't know, and I'll just keep going.
I will be making the new hair pores.
You're making new pores?
New pores.
Okay, so two things. The doctor was not wearing a mask when he's making the incisions. Is that an absolute requirement? In my book, it is. It protects the patient and the doctor from any sort of exchange of, we'll say, debris from each other, and it's just a standard practice. I'm not a fan of physicians and operating staff not wearing masks, simply because I've seen what can happen when one doesn't wear a mask. I've seen infections that are caused from staff not wearing masks. So that's something I'm not a big fan of. Secondly, he just said something that's I can't say it. I can't say it's inaccurate. He said he's making pores. He's not making pores. He's making cuts into the scalp. That I think that pores is one way to describe it, but it's not really accurate. So he's not really making pores in the skin, just so you know.
The hair, so that's a manual process. Little tiny millimeter little pores everywhere. and that you're not going to feel a thing.
So is he just like stabbing little holes in my head right now?
That's what it kind of looks like, yeah.
So you do this manually.
Yes.
And then the robot
Gets us the hair.
That's so crazy.
Now, my other question is, how can he see what he's doing without magnification? Even if these are 1 millimeter incisions, which is bigger than what I think most hairlines should be using, he's not using magnification. And what everyone watching this needs to understand is that magnification is very necessary. I'm not talking about the dissection of the grafts once they're extracted or the refinement using microscopes. I'm talking about using surgical loops so that the recipient area is more easily seen and there's a stronger field of view. That way, the hairs that are in the recipient area currently, the native hair, can be avoided much better so that there's a lower risk of surgical transection and permanent shock loss.
I've recently started doing acupuncture. Is it like that?
It's less painful than acupuncture because it's all numb. You're not going to feel a thing.
You notice we always call it procedure. Dr. Rome doesn't even like to call it surgery, the S word, because it's so non-invasive.
It's not like there's no
You're
stitches.
awake the whole.
And just to comment on what they were just talking about, the doctor doesn't like to call it a surgery because there are no stitches. I don't agree with that description because, for two reasons. Number one, it's false. It's flat out false because this is a surgery. But secondly, it downplays the significance of what can happen during surgery by not calling it a surgery, by encouraging others to not call it a surgery. It's not such a simple thing. The downsides and the potential side effects from the surgery are extremely real. There are some serious side effects that can occur due to even the injections that are being given. Infections can occur, can be transmitted. And when you look at the number of incisions that are made, not just for the recipient area where the grafts are going to be placed, but also the extraction area where the grafts are removed, the total surface area of, let's say just for argument's sake, he's using a 1 millimeter punch and it's 2,000 extractions, that's 20 square centimeters of open wound on your head. That's a surgery.
What's going on over here? Oh, a mistake to look at it.
You don't think that's awesome? Look how cool that is.
All right, so we're doing it?
We're doing it. You're gonna feel some pressure at first and then it'll release, okay?
Okay.
So the robot is going to start harvesting the hairs one at a time, and we'll be taking each hair out that the robot frees and elevates.
Is it doing it?
Yes.
Whoa. I feel nothing.
That's good.
But it's not removing the graft. That comes later. So that's all the robot is doing on this particular surgery.
If you're taking hairs from the back of my head, I'm not gonna look thin in the back of my
No,
head
because
now?
remember we said that you need 50% of the hair loss here before you start seeing thinning. So at the same time here, I would have to take 50% of these hairs before it looks thin there.
Not 100% accurate. That depends on the kind of hair, the color of the skin to the color of the hair, the contrast ratio, if the hair is curly, straight, fine, coarse, dense, not so dense, natively. There are a lot of different variables to go into that.
What we do is we take them and then we examine them under the microscope, make sure they have every component that they need to be successful. And since I already made the hair pores, the new recipient sites this morning, then we go and put those right back in.
Now you guys are taking my little hairs and you're putting them in the holes in my head. Is that correct?
Yes.
And then what keeps them there?
Your blood kind of coagulates around them and acts like glue and holds.
What the technician said is true. That's what kind of keeps the grafts in once they're inserted. It's also the pressure from the tissue on all sides of the incision clamping down, for lack of a better, on the graft and holding them in place. But the blood does act as a glue once the graft has been in there long enough for the coagulation of the blood to occur.
Here and finish cleaning you up.
It's crazy. It's just like one day for me to just get over this thing that has been silently eating away at me for years. I'm grateful that I finally mustered the courage to confront this and to do something about it. Hey, thank you guys so much.
Not a problem.
I appreciate it. This was, oh yeah. This was a pleasure. Thank you.
Notice that they're not showing the actual donor area. They're showing the sides where no hair was taken, but they're not showing the occipital region of the scalp where all the extractions were done. I don't recall hearing how many grafts he's had, but I think that'll be very interesting if they do share that.
So after a few months, they'll just begin to grow out. And this really takes about a year before the final results come in.
The day after the surgery, back in the office. Do you guys want to see my scalp?
Yes.
Kinda.
I want to see your brains.
3, 2, 1.
Oh, how about that? The back looks funny. The back one more time.
So, right, there's the extraction area, and they kept it pretty confined. It doesn't even look like they went up on the sides of that donor area to the full extent of where the outline was drawn. That was a pretty interesting video. If you haven't been exposed to hair transplantation before, you don't know much about it, and obviously it was made for, you know, this guy Zach. You know, he had a need, and you know, I think that the way that he expressed himself early on in the video and the previous video, which I didn't go through, it's where he's talking more about how his hair loss has affected him, and it shows the SMP procedure that he went through. But then it was also you know, made because the clinic, the doctor, wanted the exposure, and he has certainly gotten the exposure with currently, as of today, July 27th, well over 5 million views, which is phenomenal. But my analysis of this is that while, you know, the result itself, we can't speak about the result. I have no clue how it's going to grow or, you know, how natural it's going to look. What I do know is that the patient, Zach, he says in the previous video that he started finasteride 1 month before he set foot in the clinic, which is great. But he has a lot of miniaturized hairs, and the way that finasteride works, based on my experience over the past 17 years, is that a lot of that hair could have thickened up considerably to where maybe he might not have needed a hair transplant. He might have been happy with the final result. Will it be as strong as what surgery can do? Probably not. But on the flip side, if it doesn't work for him, or if he winds up having side effects that he just can't deal with, then he's going to continue to lose hair, and he's going to have this isolated area of growth and potentially lose a lot of hair behind it. So what this procedure has done has potentially set him up for the necessity of more surgery because he has aggressive loss in his future. I don't feel like he did his research, because in the video he was referred to this place by his hairdresser, and he didn't talk about research at all. He just went in, and the idea that because it's a robot that it's going to be easy and there's not going to be any scarring is absolutely false. The robot has nothing to do with it, and yes, there is scarring, as with every hair transplant surgery, which is another unfortunate inaccuracy. I just wanted to give my analysis of this as a counterpoint to the ease of this procedure and what it's supposed to deliver, because it might not deliver. There's no guarantee with surgery, or there shouldn't be a guarantee with surgery. There shouldn't be guaranteed outcomes. I wish him all the best. If you got any questions, throw them down in the comments section. If you haven't subscribed yet, hit that subscribe button, click the bell for future notifications. And if you felt like this was helpful for you, don't forget to hit that like button. I'm out of here. Thanks so much. And yeah, take care. Bye.